Your knee is innocent. Evidence shows 80% of runners' knee cases have absolutely zero structural damage to the knee itself. This is patellofemoral pain syndrome, or PFPS. Think of your kneecap as a train on a track. The pain signals that the train is derailing, grinding against the groove of your femur. Most runners waste months icing the knee or stretching the IT band. But here is the biomechanical twist. The train isn't jumping the track. The track is moving underneath the train. When your foot lands, your femur rotates internally. If your hip muscles, specifically the glute medius, are weak, they can't control this rotation. The femur twists, the knee collapses inward, and the passive kneecap gets crushed. This is why your MRI often comes back clean. It is a software problem, not a hardware problem. You don't have bad knees. You have incompetent hips. But knowing this creates a new problem. How do you run while fixing it? Temporary relief comes from McConnell taping, which physically pulls the patella into alignment. But for the cure, we must load the posterior chain. Forget simple clamshells. We need heavy isometric holds and dynamic stability. Finally, use the pain traffic light system. You can run with injury, but only if pain stays below a 3 out of 10. If it spikes to a 4, or if you feel stiffness the next morning, you have exceeded your tissue's current capacity. Fix the hip, save the knee. Run smart.